Good day, I'm Jackie Judd. In the 2 years since the Affordable Care Act, the health reform law, was enacted, some consumers have seen changes in their health insurance. For example, young adult children can now be covered under their parents' plans. Through the remainder of 2012, more changes will be rolled out. Here to give us a preview is Insuring Your Health columnist, Michelle Andrews. Welcome, Michelle.
Thank you.
In August, some consumers will see rebates from their health insurance companies. Under what circumstances and what's the size of the rebate?
Well, insurers who haven't paid at least 80% of the premium money that they've collected in benefits for people will have to rebate that money to consumers. And they don't really know exactly how much that's going to be. When the NAIC, a trade group, looked at it and applied 2010 figures to the law, they found that about $2 billion worth of rebates might be distributed to consumers. Now, most of those rebates would be to people who had individual policies, and they might see, a little less than $100 each. Smaller numbers of people in large group and small group plans would also see some rebates.
Also in August, an issue that has obviously been in the news is free contraceptive care kicking in at the end of the summer. As we speak, what is the plan?
Well, the free benefit would apply to people who had new health plans or plans that were changing their benefits substantially. So it won't apply to everyone right away. But what it means is that women who want to use any kind of birth control method can do so for free, and their employer will pick it up, will pay the cost. Now, there is some concern, and people who have, if you've read the newspapers, of course, everyone knows, about what to do about employers who are religiously affiliated. And in those cases, the Obama administration has proposed that those women can get that coverage through their insurer, and the employer won't have to be involved. It's not clear how exactly that would happen, and there's certainly a lot of controversy still about whether that's a workable option.
The following month, in September, insurers have to begin describing benefits in a language that lay people might better understand. Walk us through that. Where will the information be available, and who will judge what's understandable or not?
Well, as anyone who's ever tried to look at their health plan benefits knows, it's incomprehensible, and often it's in a booklet that's the size of a small novel. This creates a template that plans have to fit their benefits into, that offers up things like, what is the out-of-pocket maximum? How much is the deductible? Is there an out-of-network charge? Those kinds of things, in including a glossary of terms that provides some consistent definitions and a summary of benefits so that people can easily sort of skim what they will have.
And will all insurance companies be required to do this?
They will, and employers as well that insure their workers. There are some, not exactly wiggle room, but flexibility for plans that don't quite fit into the template right now in this period leading up to 2014 when everyone will have to be in lockstep. But that's just for things like tiered benefit plans. If you have a drug plan that has lots of different tiers that may not fit into this template that's been developed by HHS, then employers will have some flexibility in how they present that.
And in the fall, when people actually begin to plan for 2013, there is something that they need to know about with the FSA medical account.
Yes, the total that people can contribute to those accounts for 2013 will be changed and will reduce to $2,500. It's often been in the $5,000 range, and that's going to be cut substantially. So people need to think about that.
$2,500 is the max.
It's the maximum.
Okay. And a kind of footnote question. Everything we have talked about today is, of course, dependent on the health law still being enacted as we know it now.
Yes.
But in March, the Supreme Court will be hearing challenges to the law. What would happen if the court were to declare unconstitutional the mandate or the entire law to what we've been discussing?
Well, it's not entirely clear, but for consumers, what might happen, depending on what the court decided would be that some of those pieces of the law that have taken effect would go away, such as the insurance for adult children being allowed to stay on their parents' plan. That would no longer be in effect. Or the donut hole closing that a lot of seniors have taken advantage of on the prescription drug coverage, that they've spent a certain amount and they're in the donut hole. That's part of the law, and that would go away. Congress could take action to put those pieces back in, but it would take action on the part of Congress to correct that.
Okay. Thanks so much, Michelle Andrews.
Thank you.